Okay, good morning everyone. Thanks for lasting up to one of the last sessions. It's really a pleasure for me to be here, and I appreciate the discussion we've had over the course of the past 2 days. And I think what's really neat is that, over the course of the past 2 days, we've talked about how some of these very simple technologies, whether it's a lockbox or a savings account, or we even heard about a motorcycle, which might not be so simple, can really promote financial inclusion. And then this morning we talked about how one particular type of technology, namely the mobile phone, can also potentially promote financial inclusion, either as a communication device by sending and receiving SMS, as a transfer device when we're looking at mobile money, or even as a savings device if you want a very secure place to save. And so what I'm going to be talking about in my paper is particularly using mobile money for a particular type of transfer program. It's a G2P, or more specifically, an NGO to P. And the reason I think that this is relevant for us now is because a lot of countries in sub-Saharan Africa are really interested in using electronic payments for many of their cash transfer programs. Number one, because they think it might be less expensive. Number two, because they think it might be a way to promote the adoption of mobile money in the hopes of potentially increasing financial inclusion. And so, just as a little bit of motivation, I think a lot of us are not going to be too surprised by the fact that over the course of the past decade, conditional and unconditional cash transfer programs have been an extremely important part of social protection programs for a variety of both developed and developing countries. If we focus just on developing countries, back in 2010, there were about 52 countries that had some type of cash transfer program in place. And while we know a reasonable amount about the impact of these cash transfer programs on development outcomes, one of the things we don't discuss so often is really the cost to implementing these programs. And in many cases, many of you probably know that a lot of these typical cash transfer programs present logistical, operational, and security challenges associated with getting cash in small denominations to remote rural areas. And this is primarily because there isn't necessarily a very robust financial infrastructure. Now, I would argue that this kind of discussion over costs is really more than a theoretical concern. Number one, because it can really affect those cost effectiveness calculations when we compare cash transfers with another type of intervention. Dean mentioned that yesterday when comparing those two coffee bags. But it also can result in a lot of direct and indirect costs to the program recipients that we often actually don't capture when we're doing our evaluations or when we're doing our cost effectiveness calculations. So what I'd like to do is leave East Africa and go back to West Africa, to Niger. Many of you probably know Niger. In 2009, there was a drought and almost a complete crop failure. And what that meant by early 2010 is that about 7 million people, which is about half of the population of Niger at the time, were experiencing extreme food shortages. Now, the way in which the government and many NGOs dealt with this was by distributing food aid and cash during the hungry season to help people kind of deal with these shocks and these crises. And you would often think that, in a context such as Niger, it wouldn't be kind of too difficult to maybe distribute these cash. After all, it wasn't like Haiti after the earthquake or Pakistan after the floods. But it's important to remember that Niger is one of the largest countries in sub-Saharan Africa, with few paved roads, one bank for every 100,000 people. And at the time, there were these intermittent skirmishes along the Niger-Mali border. So by early 2010, what had happened was that mobile money, which was a new technology at the time, was actually introduced into Niger. And what this did is that it gave a lot of people an opportunity not only to do person-to-person transfers, but also the government and NGOs potentially to use the technology as a way to make these unconditional cash transfers. Now, a way in which kind of a lot of these traditional cash transfer programs actually happen was that you would have to go to a bank, count out the cash into individual envelopes. You would then have to transport the cash to remote villages, and then you would have to kind of hire security to make sure that your cash actually wasn't stolen or on the way. So you can see here, and this isn't kind of an extreme situation, this is fairly typical of many cash transfer programs, and so you can imagine that this kind of makes a lot of additional transport, security, and logistical costs associated with doing these cash transfer programs, that when you had the introduction of mobile money, offered a different type of alternative to actually implementing it the traditional way. So what our research goals were in working with an NGO, Concern Worldwide, were basically threefold. Number one, we wanted to see whether or not basically the cash transfer delivery mechanism affected the costs of implementing this program, both for the implementing agency and for the actual beneficiaries, and did that affect leakage or corruption. Number two, was there something in terms of an effect beyond cost reduction? So did it have other impacts on household behavior and well-being? And if so, basically why? And the way that we did this was we linked up with a local NGO, Concern Worldwide. We used a randomized controlled trial. I'll talk a little bit more about that. And then we collected a variety of quantitative and qualitative behavior, not only on cost, but also behavior, prices, and different types of mechanisms. So the basic cash transfer intervention, to give you a little bit of a context, was the following. It was implemented in response to this food crisis, as I mentioned previously. It was unconditional, so people could do whatever they wanted to with the cash. And it was $45 over about 5 months, which is a significant injection of cash into these households. It represented a significant kind of percentage of their per capita GDP. It was primarily provided during the hungry season to allow people to kind of deal with some of these shocks and prevent severe malnutrition and asset decapitalization. And the targeting mainly occurred at targeting the most vulnerable households in villages that were hit by this drought. So they did a vulnerability exercise, and within the household, the person that was targeted was the woman. Now, in terms of the research design, of those 116 villages, we focused on 96 villages. And the reason that we did that is that there were 20 villages that were nearby the Malian border, which meant that the NGO really wanted to use electronic cash transfers because of security concerns. So they did that, and they were outside of our research sample. We focused on the 96, and those 96 were randomly assigned to one of 3 interventions. One was what we call the cash. It was just a manual cash intervention. You received cash the good old-fashioned way in an envelope, either in your village or a nearby village. The second one was what we call mobile. So you also received the cash the good old-fashioned way in an envelope, but you also received a mobile phone. And that mobile phone was mobile money enabled, so you could use mobile money if you wanted to. You also had a training on mobile money. And the third one was what we called ZAP. So you received this mobile phone with mobile money on it and the training, but you actually received the cash transfer via the mobile phone. So what you notice here is that there was no pure control group. It was a food crisis situation. It would not have been ethical for us to withheld kind of the cash transfer from certain populations. So the NGO chose the villages where they wanted to go to, and then we randomly assigned the different cash transfer delivery mechanisms. Secondly, we had no differences in the timing of the transfers, which you could imagine would be kind of neat with mobile money, but that wasn't possible at the time. And the value of the phone here was about $5. So to give us a sense of kind of what we were trying to do with this research design, you know, if we had a comparison group, then we would be able to compare kind of those people who received the cash transfer with those who didn't. That would give us the impact of the cash transfer program. We didn't have a comparison group, so we can't really say anything about that. What we can do is look at kind of the relative costs and benefits of these different type of kind of cash transfer delivery mechanisms. So if you compare the mobile group with the cash group, you basically say they both got cash in a manual way. Is there any additional benefit from getting a mobile phone? And if you compare the ZAP group with the mobile group, you both say, well, they both got cash and mobile phones, but is there any additional benefit potentially of receiving the cash via a mobile money platform? And so if we want to kind of understand a little bit some of these challenges, because Niger was not like Kenya at the time, remember mobile money was quite new in Niger. It had been introduced earlier in the year. What that meant was that there were very few agents, very little consumer familiarity with the program, very low adoption, low mobile phone penetration in these areas of Niger. About 30% of households owned a mobile phone. Very high illiteracy rates, about 80 to 85%, so people could not read or write in any language, which brings some challenges if you want to choose a PIN number, remember your PIN number, figure out how to actually get into that menu. And at the time, there was some limited operational capacity of the mobile phone service provider in the mobile money sphere. So because of some of these challenges, the NGO had to work closely with Zain, which then became Airtel, to address some of these challenges, which meant kind of one of two things. Number one, we saw that they distributed mobile phones, simply because mobile phone penetration was only 30%. Now that's increased quite substantially to about 80 to 85%. Two, it meant that they had to do a sensitization campaign, really explaining what it was, having posters, kind of skits, so that people could understand what this new product was and how to use it, specifically in terms of their PIN numbers. And three, it meant working closely with Zain and Airtel to really kind of register mobile money agents. So Concern didn't say anything about where you were registering the agents. It was just trying to kind of promote the registration of these agents within the general area where it was operating, so people could actually cash out. So if we kind of change the way in which we distribute cash, why would we expect to see any effects? Well, first of all, it might just make things cheaper for the program recipient to get their cash. And because it takes you less time, takes you less money, maybe you can use that for more productive purposes, or potentially just changes the timing and location of where you use that cash transfer. Now you go to an agent, rather than going to the market, you buy stuff from the agent if he or she owns a kiosk. Secondly, as Billy talked about this morning, you could use it for other types of purposes, namely receiving cash transfers from migrants. Niger has kind of a high degree of seasonal migration, so now you could use this to get kind of access to remittances from those seasonal migrants. Third, maybe it has nothing to do with mobile money, it's the communication kind of that is facilitated via the mobile phone. Now you can call up someone and say, will you send me the money, even though it's via the bus, which allows you to kind of withstand those shocks. And then the last two are related to things like privacy, which we talked about a little bit at the end of yesterday. You can imagine that if you get an envelope in front of a village, all of a sudden everyone knows that you got money and they generally know what you got. But if you receive it via mobile money, that might make it a little bit more private, which might affect kind of how much you are sharing with other households within the village. It also might affect how much you're sharing kind of with other members within your family. And so these are the 5 mechanisms we were really interested in testing to see whether or not kind of there were any types of impacts. So in terms of the impacts, we focused on 3 things: the costs, kind of well-being, and the actual mechanisms. In terms of the costs, this basically shows the total costs in euros to the implementing agency for setting up and implementing the program. In blue is for the ZAP, for the mobile money, and green for money is for the manual cash transfer. And what you see at the beginning is there's huge fix and startup costs, which is mainly associated to the fact that they were buying mobile phones. But after that initial fixed cost, kind of the cost went down quite substantially for the mobile money as compared with the manual cash. The cost per recipient was about $1 more in the ZAP households as compared with the manual cash. But if that program had actually been extended out another 2 or 3 months, it would have been less expensive in the mobile money group. Then we looked at kind of the actual cost to the program recipients themselves to see whether or not this changed how much time and energy they were spending when actually getting their cash. And what we saw is that those who were in basically the manual cash group had to travel 5 kilometers, which is about an hour time, round trip to get their cash. Because remember, you don't necessarily distribute cash in every single village. And then there was additional wait time. For the ZAP group, they had to travel basically 1 kilometer round trip. So kind of they were cutting it by over 75%, which was going to give them basically less than 10 or 20 minutes. And so there was a kind of a significant cost saving and opportunity cost of their time, which you could kind of try and put a dollar value to that and would have translated into additional expenditures that the ZAP households could have had. In terms of actually kind of how people were using their cash transfer and whether or not the mechanism had an impact, I'm just going to focus on kind of 2 main outcomes here. The first one was in terms of purchases. So how were people using their cash transfer? It was during a food crisis. They were mainly using it to deal with their kind of immediate needs: food, health, and that was about it. Almost everyone was using it to buy kind of a sack of grain, a 100-kilogram sack of grain. Very few people were using it for other things like seeds or school fees or reimbursing debts or buying clothing. And there wasn't a difference in terms of the ZAP and the manual cash households. But what was interesting is that the ZAP households were buying a more diverse set of food and non-food items. And what were they actually buying? Well, they were more likely to buy things like cowpeas, meats, condiments, and oil. And there's a statistically significant difference between these 2 groups. So they were buying more. What were they buying more of? These 4 different types of food items. Now, we could say that just buying more stuff isn't necessarily a sign of kind of the fact that we're better off. We'd like to see whether or not that translates into any types of differences in well-being. And what we do there is then we look at kind of some food security measures, household diet diversity, and then we looked at kind of the breakdown of household diet diversity. What we found in overall was that household diet diversity was about 16% higher in the ZAP households as compared with both the manual cash and the mobile households, and this difference was statistically significant. And why was it higher? Well, it was higher because people were consuming more of the things that I told you that they just purchased. They were consuming more beans, they were consuming more condiments, and they were consuming more fats, which in kind of the diet of Niger, where you have a household diet diversity of 3, as compared with kind of a metric of 12, getting more kind of beans and condiments and fats into your diet can be extremely, extremely important. It also related to kind of changes in the number of meals that children were getting. So they were getting kind of a third more meals over the course of the day. We saw that overall kind of a measure of nutritional status was higher in ZAP households, but that difference wasn't statistically significant at conventional levels. So the key question here is why? We saw that costs went down, both for the agency and for the beneficiaries. We saw that purchases were more diverse and they had higher diet diversity. And so we go back to kind of our original hypotheses. First, we said that maybe it changed the timing and location of the expenditures. We didn't really find very much evidence of that. Maybe you got your cash 2 or 3 days later if you were in the ZAP households, but once you got your cash, you didn't necessarily buy things from that agent. So it wasn't changing, whether or not you actually bought foodstuffs within the village or bought them at the market. You almost always bought them at the market. The second thing we looked at was kind of what Billy alluded to this morning. Well, now we're using it more to get remittances from other migrants. We didn't really find very much on that either. And there's, I think, a bunch of reasons potentially for that. A lot of the international migrants in Niger are international, and you couldn't use it for international remittances at the time. And also relating to this illiteracy problem, many people had difficulty in manipulating kind of the mobile money by themselves. Third, we looked at kind of reduced communication costs. We found that in the ZAP and the mobile groups, they were using mobile phones more, but the fact that they were both using mobile phones more couldn't necessarily explain the difference between these two groups. The last two that we looked at was this privacy thing. So did it affect kind of your likelihood of sharing with other people? About 20% of cash households were sharing actually their cash or their goods with other households within the village, but there weren't any kind of differential effects across the cash, mobile, and ZAP groups. And the thing that we could really come down to, though, was basically this kind of issue of intra-household decision-making and privacy within the household. And so let me just give you a little bit of information on the qualitative work we did and then the quantitative work. So qualitatively, we did focus group discussions in the cash and the ZAP villages. And in the manual cash villages, what they said is that they often went to the place where they were going to receive their cash. They received their envelope. And because in this area of Niger, women often don't travel to markets by themselves or in groups, what that meant is that someone else within your household, usually your husband or your son, would go to the market for you. And because it was publicly observable, what they often reported was that they would give that money to someone else within their household and have very little time for discussion for what they were going to buy. In the ZAP villages, that was a little bit different. And so what women will do is they have basically kind of a little sack that's around their neck. They'll carry the mobile phone around their neck. As soon as the money comes in, they hear that beep. And it's a special beep. It's not kind of an SMS beep. And they knew that they got it. Now they would tell their husbands, but as they said, I wouldn't tell him right away. I would tell him maybe later that evening, in the privacy of our home, where a lot of other people actually weren't looking at us, and we could actually discuss how we were going to use the money and what we were going to buy. And remember, they had a day or two before they went and actually cashed out. And so what they discussed was the fact that this allowed them to discuss their purchasing priorities at home. Now we have some quantitative evidence of that as well in terms of direct and indirect measures. What we basically found is that it didn't really affect kind of women's involvement in decision making. All women stated that they were involved in how the money was going to be spent. But what we did find is that males in ZAP households traveled farther to purchase some of these items. They were often getting at these items at a lower cost. ZAP respondents, the women, were often kind of going to cash out by themselves. And expenditures for the Muslim festival of Tabaski was actually higher in ZAP households as compared with the cash and the mobile group. So kind of what we think the mechanisms are that are really driving this is that it seemed to kind of change the way in which decisions were made within the household related to some of these privacies that are afforded via mobile money. So just to conclude, it basically mobile money here kind of decreased the implementation costs both for the agency but also for the program recipients. Definitely, if you want to be thinking about external validity, this could potentially have been cheaper in an environment where that infrastructure already exists, but there's still these issues around sensitization and PINs. There were these benefits beyond the simple cost reduction. You might even see kind of larger benefits, but it's hard to actually know because here the marginal utility of income was quite high. It was during a food crisis. And what we posit in terms of kind of an approach is that basically it increased women's control over resources, but obviously this is going to be very context specific. And in terms of policy, I just want to kind of basically highlight the fact that I think we have some of these studies, but we need a lot more in order to really understand what these impacts are, to kind of highlight as well what we talked about this morning, that just having a mobile money kind of network isn't going to be sufficient. We have to address things like the agent network and sensitization. We also have to think about the profits to the mobile money operators for it to be sustainable for them. And then, while mobile money has the potential to promote financial inclusion, financial inclusion isn't just going to be kind of transfers by itself, but also thinking about savings, credit, and insurance. And even if we use payments to potentially push kind of take up or adoption of mobile money, the key question is coming back to, are people actually going to use it? And so I think that that's going to be important for the longer term. Thank you.